It's the age-old question, to circumcise or not to circumcise? Back in the day, circumcision was the standard, but nowadays more and more men are passing on the old snip. So why do people circumcise their baby boys? Are there any health benefits or risks associated with getting this 1,000-year-old procedure done? If you don't know what a circumcision is, chances are you don't have one. Circumcision is the act of cutting and removing the foreskin from the end of a male's penis, and for thousands of years, cultures and religions around the world have circumcised their baby boys or adolescent males for various reasons. In Judaism, a rabbi performs a circumcision on a baby boy when he's 8 days old. Likewise, in many Christian faiths, circumcision is encouraged shortly after birth. But it's not just babies that have the ritual done. In many African cultures, circumcision is done on boys just as they enter puberty, a tradition used to mark the teen's entry into manhood. But it's not always for cultural or religious reasons. Some people prefer the aesthetic look or ease when it comes to grooming, while some fathers simply want the same for their son that was done to them when they were young. So what's the real difference? There isn't a whole lot of functional difference between a circumcised and an uncircumcised penis, to be perfectly honest. Think of it like a car. There's manual transmission and automatic transmission. Both will get you where you need to go. One just comes with a little extra training and skill needed to operate the thing. In saying that, circumcision does have a few health benefits associated with it. A circumcised penis is far easier to keep clean than an uncircumcised one, and drastically cuts down how much time you need to spend washing your junk. For an expert guide on the topic, check out our other video, How to Clean Your Penis. The link is in the description below. Circumcised penises have a reduced chance of contracting sexually transmitted diseases and are also less likely to fall victim to urinary tract infections and inflammatory conditions such as balanitis. But that's not all. Despite how rare the condition is, research has shown that circumcised males have lower incidences of penile cancer compared to their uncircumcised counterparts. On the flip side, the foreskin contains a branch of the dorsal nerve and around 20,000 specialized nerve endings that enhance the feelings of pleasure during sexual activity. Circumcised males have a slightly reduced sensation in their penis, which can result in various erectile dysfunction conditions. Circumcision also comes with an amount of risk. If the procedure is performed incorrectly, it can horribly disfigure a boy's penis and can leave it both functionally and visually impaired, often needing corrective surgery to fix. In the 1980s, between 76% and 92% of adult males were circumcised. Since then, the number of newborn babies having the procedure done has dropped by approximately 20%, with the expectation that it'll fall even further in the years to come. These days, most of the health and hygiene concerns can be addressed with a little education, and so really the choice comes down to either religious tradition or personal preference. Most boys don't get to choose this, as it's done soon after birth, but it's important to know for both yourself and the kids that you may eventually have one day. Now that you've got a better understanding of the pros and cons of circumcision and non-circumcision, we want to know how you feel about it. Do you feel this choice should be yours to make? Or are you just happy you were too young at the time to remember it? Let us know in the comments below. If you found this video helpful, please leave us a like and share it with anyone you think may be interested in this topic. Until next time, thanks for watching.